I am Dr. Manish Mahendra, cataract and refractive surgeon at Mahendra Eye Institute, Kanpur. I'll be showing you a case of pupil cerclage with toric IOL implantation. This is a case of a traumatic cataract with a dilated atonic pupil. So we are planning to do a toric IOL implantation here followed by pupil cerclage. We make a stab incision, stain the anterior capsule with the help of trypan glue, and then perform the capsulorhexis using the cystitome. One must remember whenever you are dealing with such traumatic cases, you may encounter a zonular dialysis. A gentle hydrodissection is now performed. And now we start with the phacoemulsification procedure. We break the nucleus into multiple fragments and emulsify them. One has to be very careful while emulsifying the last piece so that there is no sudden surge. After the phacoemulsification, we move on to do the bimanual irrigation and aspiration technique. Here we have to be careful that we don't stress on the zonules so that we don't inadvertently cause a zonular dialysis. A CTR should always be ready if at all it is required. We move on now to place a toric lens here. We are implanting a 3 diopter cylinder lens. The lens is injected, which sits in the bag. This is followed by removal of the viscoelastics above the lens as well as behind it. A thorough viscoelastic removal is done to prevent the lens rotation. And finally, we align the lens with the marks on the cornea. After injecting intracameral pilocarpine, we use micrograspers to stretch the iris all around. So now we plan to do the pupil cerclage technique to make the pupil round to a 3 millimeter size. So we started making a nasal paracentesis, and now using my 27 gauge cannula, I'm docking the needle of 10-0 double-armed Prolene suture. This is to prevent the entrapment of corneal fibers. With the help of this curved needle, we will take bites on the iris tissue from the pupillary border. The bites are made approximately half a millimeter from the pupil edge and approximately a millimeter apart or so. This will help round out the pupil as much as possible. The use of a microgasper helps us to mobilize our iris into position. We now use a 27 gauge cannula to dock the needle and withdraw it gradually. With the other needle of the double arm suture, we pass it through the iris in a similar fashion and take multiple bites. Notice the needle actually doesn't do a lot of work. Actually, it's the forceps hand bringing the iris to the needle that helps pass the needle through the peripheral iris. The needle is now docked into the lumen of the 27 gauge cannula and withdrawn gradually as before. We now take the other end of the needle of the 10-0 Prolene suture, dock it into the lumen of 26 gauge cannula, and pass it through the paracentesis. Take iris bites at the pupillary border. Once this procedure is done, you withdraw the needle gradually in a similar fashion, taking care not to damage the iris tissue. Both ends of the sutures are then tied with the help of microgasper and McPherson forceps, or intraocular tying forceps can be tried. The knot is tied and suture ends are cut with micro scissors, making the pupil round. Thank you for watching. See you in the next surgical case.